Welcome back to Great Day Washington. You know, worldwide, osteoporosis causes more than 8.9 million fractures annually, resulting in a fracture about every 3 seconds. That's according to the International Osteoporosis Foundation. Here to tell us more about who's at risk and treatment options is Dr. Rachel Kaiser. She's from the Arthritis and Rheumatism Associates. Thank you so much, doctor, for coming in.
Thank you for having me.
8.9 million people. That's men, that's women. That's pretty prevalent. What is osteoporosis?
So, as you say, osteoporosis is a very common disease that's essentially a decrease in the strength of bone. So, the word osteoporosis actually means porous bone. So, I brought a couple of examples. So, this is an example of normal bone.
Okay, hold them tight.
You can see it's strong and thick.
That's normal.
And this is an example of osteoporotic bone. And so you can see it's thinner, it's very disorganized, it looks like there are pores and holes in it.
You can drive a truck through that one. And that really weakens things, doesn't it?
Right. So what happens is patients with osteoporosis are at risk of a fracture from what seems to be a very minor trauma. So slipping on the ice in the winter or tripping over a throw rug at home can result in a wrist fracture or even worse, a hip or a spine fracture. And clearly, those are painful and tough to recover from in the short term.
Yeah.
But in the long term, people can have height loss, chronic pain, stooped posture, and disability. And so, unfortunately, osteoporosis is a very slowly progressive disease that has no symptoms until someone has a fracture.
Well, how do we know we have it? I can't see my bones. Is there a test or something for that?
Right. So there are a lot of risk factors for osteoporosis. And so, as you mentioned, we think of it often as a disease of postmenopausal women, but men and other all sorts of patients can be at risk. So some of the most common risk factors are just simply advanced age. So if you're a woman at 65 or older or a man over 70, you should definitely be tested. If you have a family history, so if your parent had a hip fracture, you are at risk of a fracture or osteoporosis. If you yourself have had one of these fragility fractures, you're at much higher risk of having another one. There are certain medications that raise your risk of developing osteoporosis. So as rheumatologists, we use sometimes steroids to treat flares of our disease processes, and that can lead to the development of osteoporosis. So there are actually many more risk factors, and patients can talk to their doctors to estimate their individual risk.
You're a rheumatologist.
Correct.
So how do you test it? When someone comes in and sits down and says, doctor, do I have it or don't I? What do you say?
Right. And so the first thing we start with is a good history. So talking to patients about their health history and that of their family members, like I mentioned, and finding out if they've had a fracture before. And then taking a good physical exam and is important. And then what we do is if we think you're at risk of fracture, we order what's called a bone density test. And in our practice, we have these in our clinic. And what that is, it's a low-level X-ray that takes pictures of the bones. So what happens is a patient lies on a table, and then the machine takes the images. And then the way we interpret the results is, as the bone density is decreasing, your risk of fracture goes up.
It doesn't hurt, though, this
No,
test?
it only takes a few minutes.
Okay. And you said treatment. Is steroids is one thing. Is there anything else?
So steroids are actually one of the things that can contribute to the development of osteoporosis.
Oh, okay.
So the good news about this is that this is a treatable disease. And so with early diagnosis and appropriate management, we can actually prevent fractures. So a healthy diet that has enough of calcium and vitamin D is important. Weight-bearing exercise is very important. So that is, example of that would be just walking 30 minutes 3 times a week. Okay, and then there are very great medicines nowadays that are specifically targeted to slow down the bone loss, strengthen what you have already, and even in some cases build new bone. And so they come in a variety of forms, as simple as a pill taken once a week. So you might have heard of Fosamax or Alendronate.
My doctor has. As a matter of fact, if I'm working with my doctor, can he send me to see you? How does that work?
Yeah, and so one of the latest advances in these drugs is in biologic medications. And so those are given often as injectables or infusions. And one of them is called Prolia. It's an injection every 6 months. And that's given by a skilled nurse in a facility. And so if you've been diagnosed with osteoporosis, what your doctor can do is refer you to a Rise infusion. And we have 5 centers in the D.C., Maryland area. And we've been doing this for over 15 years, treating osteoporosis and other autoimmune diseases. And the nurses are highly skilled, very compassionate, very good at answering questions from patients who may be unfamiliar with this kind of a treatment.
Yeah, you got a great staff. Dr. Kaiser, thank you so much. I appreciate it. It's Arise Infusion Therapy. All right, good. By the way, if you want to schedule an appointment with a rheumatologist at Arise, okay, is it Arthritis and Rheumatism Associates, call 240-514-5620, or you can go to WashingtonArthritis.com, WashingtonArthritis.com/WUSA9. To speak to a coordinator at Arise Infusion Therapy Services, call 240-514-5001, or you can go to AriseInfusion.com/WUSA9. All right, up next, we're going to check back in with Megan